now to a medtech story, an Aussie small cap, Anteris Technologies, one of the recent presenters at a symposium on next generation technologies. Now, the heart valve manufacturer also recently reaching some major product development milestones. We're pleased to say we're joined by Wayne Paterson. He is CEO at Anteris Technologies, joins us now live via Skype from Minnesota. A pleasure to have you on the program. Thank you so much for joining us here on AusBiz. For those viewers that don't know much about the business, just talk us through Anteris Technologies, what you're all about.
Great. Well, firstly, thank you for having me, and good morning to you guys down there. So Anteris Technology is actually a developer of next generation heart valves. We make hearts for predominantly the disease state that's known as aortic stenosis. So basically when a valve that you're born with starts to calcify, it becomes heavily calcified, and the valve becomes less efficient over time, and eventually that has to be replaced at some point when you're in your 60s, 70s, or 80s. So the market space that we operate in has potential to be worth around about $8 billion by 2025, could be upwards of $10 billion. It's about $5 billion US today as we stand.
And I guess with an ever-aging population, this is going to be more and more of an issue globally. But specifically, how is your solution looking to work? How does it compare to what's already out in the market and what's being done in surgeries?
Yeah, great point. The number of patients actually being treated, even though it's still worth $5 billion, is still significantly small. Now, the difference we have, there are basically two major players in the space that we deal in. And this is an area where there's already been a bit of a revolution over time. When they replaced your valve previously, they would give you open heart surgery. They would crack your chest, break it open, go in there and surgically replace that valve. That procedure would take about 4 hours, and you would take about 6 weeks to recover. A few years back, a couple of the bigger companies here in the States came up with a solution for patients who could not tolerate that kind of surgery, basically placing that valve onto a catheter and inserting that through your femoral artery around your groin area, putting that valve in your heart, and that procedure takes about 25 to 30 minutes, and you're pretty much out and done within about 3 days. So there's a big significant difference. We operate in the second space. Now, the key factor that we bring, actually there are two to the market. One, these valves that are currently being used for, say, the last 5 years particularly, are not particularly robust. They were used in older patients, but they also tend to suffer from the same condition that that your original valve fails from, which is calcification. So Anteris brings the preeminent, most useful tissue treatment in the world right now, certainly the most widely studied and researched, which is called ADAPT. So our tissue treatment, what the material of this valve is treated with an anti-calcification process that's very well researched. And we've proven that we don't calcify up to 10 years, which is significantly longer than the other materials that are used in these valves. That's the first point. The second point is we have a very unique valve design. It is a 3D single-piece valve. All of the other valves in the market are made of 3 different pieces put together. Now that 3D single-piece valve has some significant benefits. The results we put out yesterday, both from a laboratory test and with a human study, show that not only is our valve functioning better than what's in the market from a hemodynamic point of view, but it's functioning as well as your native valve when you were basically born, as measured by the hemodynamics and other parameters. Now, that hasn't been seen in the market before, actually, to come out with a replacement valve that actually acts like your valve when you're basically born. So that's a huge step forward to have a valve that will function in that regard. Obviously, very good outcome for patients who would get this valve coming out of hospital.
Yeah, indeed. I guess the question here is, how's the last few months been? I mean, you've obviously reached quite a few milestones, despite, I guess, the adversity going on around the globe with the coronavirus pandemic. Has it impacted you in any way?
Look, we've been very fortunate, I would say, that most of the work we've been doing certainly is development laboratory work. I think the big question mark we had was our clinical study, which was penciled last year to start early this year, pre-COVID. And of course, when you're talking about the hospitals here in the US and in Europe, there's been significant pressure on the hospitals as a result of COVID. That being said, we certainly got that human study started, fortunately, and the patients are doing very, very well. We've had 4 patients go through that study so far of 15. And we're on track to basically finish that study by November of this year.
As far as those humans who agreed to go through that study process, how did that come about? Was it that they weren't able to participate for a specific reason in what's on the market, or they really wanted to be at the forefront of what you're doing?
So the professor who is doing this study for us is one of the preeminent surgeons in this space. He's done a lot of early valve work for other companies historically. I think, a patient has a decision when they come in, and a physician will offer them a choice if there is a clinical study. And that choice is you can have, a currently available valve, or you can have an experimental valve that appears to be working better than what's available, and you give your informed consent. So they were eligible for other valves. What we have seen in that study, when we compare our results to date with commercial valves coming from that institution, so other patients who have had commercial valves by this surgeon, is that our results are significantly better than the commercial valves. In fact, the surgeon did say to me that he has not seen the kind of results we're getting with our valve from any commercial valve that he's placed. So patients are given a choice. It's a fairly simple informed consent process from there if they choose to undergo an experimental procedure.
And then from the surgeon's side, is there any extra layer of complication with them actually performing the surgery with this solution? Is there anything different that they have to modify in how they actually implement your valves?
No, in fact, it's a very well-worn path with regards to these kind of valves. They've been doing valve replacement for quite a while. We've certainly evolved the space with the technologies that we have, the tissue science and the valve design. But it's a very straightforward process, whether it's done surgically or whether it's done through a catheter, as I mentioned earlier. But these are well-worn paths and very well known. So there's no additional level of effort from using an Anteris DuraBar valve.
Okay, so give us an idea of timeline now. Obviously, it's you've reached a lot of milestones already. What is your goal kind of for the next 6 to 12 months, particularly with this particular project?
Right, so we're obviously going to finish the human study. We have another animal study ongoing here in Minneapolis at one of the labs. We also have potential deal discussions that are going on with a couple of the major companies in this space. I think the breakthrough for me in the next 6 to 12 months is that we will be submitting to the FDA for breakthrough status based on the innovation that we bring to the market. So depending on how successful that is, that'll obviously change the dynamic of the company as we move forward.
Is there a cost element to this, since you're right in the thick of the research, the human and the animal studies? Are you going to need to raise more capital to really push this forward and get that coverage globally?
Yeah, I mean, obviously, as a development company, you always need capital to keep things moving. We've got a history of doing good deals and monetizing the technology that we have, predominantly the ADAPT technology. We've raised non-dilutive capital for the past 2 years to fund the company. As mentioned earlier, we're deep in discussions with multiple companies on our technology at the moment in partnership discussions. My expectation is that the incoming capital generally would be non-dilutive. That being said, things can always take longer or whatever. So, but the point is we will need capital moving forward, whether it's dilutive or non-dilutive. My expectation is it would be non-dilutive and coming from deals as we've done in the past.
Well, it's been fantastic having you join us live on AusBiz, talking us through some groundbreaking technology, and we wish you all the best of luck.
Great. Thank you so much for your time, and I appreciate being here.